Hi, I'm Dr. Jack Cush with RheumNow. Here are some takeaways from our January 27th podcast. 1. Yes, there is such a thing as dry synovitis. It's in kids. They're young. They have polyarthralgia, but no palpable swollen joints. And they have negative tests. But if you do an MRI, it shows synovitis. And they may develop contractures over time and osteochondral changes. It's a scary group, but it's different than poly-JIA. 2. Prednisone. Don't use it in scleroderma or systemic sclerosis. It doesn't work, especially early in disease. 3. Vitamin D. Should you measure it in lupus? Yes, but will treating vitamin D when it's low in lupus result in better outcomes? No, at least based on a 700-patient study. 4. How do you treat latent TB? That's a positive TB test, negative chest x-ray, no symptoms. Preferred regimen is, as you know, rifampin, daily for 4 months. Second preferred is something called rifapentin plus INH, given intermittently each week for only 3 months. These do really, really well. 5th, what if you're on a JAK inhibitor and you need to switch? They didn't do well, they had a side effect. You can change to another JAK inhibitor or change to another biologic. A very large study called the Jackpot study says either is okay. Next, what about Belimumab in lupus patients who get pregnant? Wow, it's a really complex study. 2 of them actually published in the last month. Really don't know what to say. So ACR guidelines say it's okay to get pregnant on Belimumab, but you probably shouldn't continue it during pregnancy unless you have really severe life-threatening disease. Questions from viewers. First answer is yes, I would use a TNF inhibitor in someone who has melanoma in situ. No, I probably wouldn't in someone who has invasive melanoma. There's pretty clear evidence for this, in my opinion. Second, do I measure CPK in patients on JAK inhibitors? Yes, I do. Early on, 6 months later, and if it's elevated, I just follow it. I'm not going to treat it because none of these patients ever develop muscle disease. And lastly, do I do a blood test for fibromyalgia called FM/a? No. Will I ever do it? No. Why? It's expensive. Why? It has no good data to support its use. Third, it's not really diagnostic. It sort of maybe has an indication. Fourth, the science behind this is weak. Can I be more emphatic about not using this? Fibromyalgia is a clinical diagnosis. Rheums, they're great at making diagnoses. They're supposed to be great at diagnosing fibromyalgia. Go to a rheumatologist. He can diagnose fibromyalgia. I expect you'll be talking about all these topics at the water cooler tomorrow. So, if you want to know more, listen to the weekly podcast. We'll talk to you next week.